The BC NDP government says a new substance use treatment and recovery centre it calls first of its kind has helped 94 people since it opened about 3 months ago.
This program is already showing remarkable promise.
The road to recovery at St. Paul's Hospital in Vancouver opened in September with 14 detox beds. Another 20 transitional care beds were added in October. On Monday, the Premier and Mental Health and Addictions Minister touted the program's success while interviewing staff during a talk show-style media availability.
Can you talk about what makes this model different or why it's going to be more successful from your perspective or how it's working?
Yeah, absolutely. The Road to Recovery model was really developed by frontline clinicians and interdisciplinary care team, where over time our experience with patients really highlighted where we saw cracks in the system.
The province says through the program, people receive seamless support through each stage of treatment, all from the same clinical team. It's a partnership between the province, Providence Healthcare, Vancouver Coastal Health, and the BC Centre on Substance Use.
Imagine if we could make access to treatment and recovery for people who needed it as easy as it were to access illicit drugs off the street.
Guy Felicella, a former drug user, says he's seen wait times for a treatment bed drop from weeks to sometimes just a day. He says the program is a good step, but there are still gaps.
Going into treatment for 90 days, that is not going to change often other people's social determinants of health, such as, housing and employment. These are all other components that needed to be added on after, but that's not so much just a government job, that's a society job.
The province says Road to Recovery will be fully implemented by March 2025, when it'll have 95 beds. It also plans to expand the program to other parts of the province, but the Premier couldn't say where or when.
I feel as much urgency as anyone to get these beds open to support people in recovery, and I know our health authorities are keen to get these beds open as well, so we'll move as quickly as we can, but I don't have a date for you right now.
Last week, the BC Coroner Service said 189 people died in October because of the unregulated toxic drug supply, which it says is the leading cause of death for British Columbians aged 10 to 59. In Vancouver, Monika Gul, City News.